So I'm assuming everybody can see that. Out of interest, does anybody, I know Michael, you have, anybody heard of JDC and JDC Israel before? Cody Institute, yeah. Can't see everybody now. Not? Okay, fantastic. I mean, today we're going to focus more on JDC Israel and specifically our work with older adults, but JDC is actually a global international humanitarian organization that operates in approximately 70 countries. And it's a conversation on its own. It's been running for over 100 years. But specifically today, we're going to talk about the focus of our work here in Israel, which is in social R&D as an innovation organization. Before we start, I mean, basically our work overseas pretty much is looking after the poorest Jews in the world. That's really how the organization was established. In second and third world countries that don't have an infrastructure to care for the weakest Jews. But here in Israel, our work is very different, and we're going to speak about that now as soon as Noam gives me the go-ahead. We also do humanitarian work around the world. We do response to earthquakes, the tsunamis. We were operating in Thailand, in Haiti, in Turkey, various countries around the world where there have been crises. So JDC has been involved with that for a couple of decades as well.
Okay, Mark, I think we can start.
We're good to go?
Yeah,
Great.
Go ahead. Everyone can see the screen, right?
Except for me.
Can you all see the share screen? Yeah?
So the reminders, am I going to?
Yeah, go ahead. Talk about the reminders just to be clear, and then we'll go ahead.
Okay, great. So first of all, the session is being recorded. So afterwards we can potentially share the links with you, and you can rewatch it again or share it with others. There will be breakout sessions later on as part of the session. There will also be a group photo moment sometime over the next hour or two. And if you don't want to be part of that photo, so we will tell you ahead of time and you can just switch off your video. Alternatively, you can go and put on some makeup and then come back and look good for the photo. So if you don't want to be included, you're welcome to just turn off your camera. In terms of communication, since there are a number of us here on at once, if you hit Q in the chat box, if you want us to pause for a question or comment, so just type Q there. That's wish without the H. If you have technical difficulties, just type Kim, and Kim from the Institute will be in touch with you. And if you have content requests, just type Noam, and Noam will be in touch with you. So that gets all the logistics out the way. Great, so let's talk about JDC and JDC Israel. I mentioned very briefly, JDC is a Jewish humanitarian organization that operates in 70 countries. But here in Israel, it has a very unique role. We work specifically in social innovation, social R&D, specifically focused on four vulnerable populations, particularly older adults or the elderly, children and youth at risk, people living with disabilities, and the chronically unemployed. And it's important that the way we work is we collaborate, we partner with the government of Israel. So we're not subordinate to the government of Israel, we're independent of the government. The government sees JDC Israel as an honest broker, and we convene the various players, the various ministries, multiple ministries, the major NGOs, profits and for-profits, organizations that are involved with working with each of these vulnerable populations. We really convene them around the table, and we work in developing solutions, interventions to support these various populations. So that's very briefly what our role is here in Israel, and it's something we've been doing working in social R&D for the last 51 years. The next slide. So we're talking today. We're going to talk today. So now we've got a short video which will speak a little bit about how we work here in Israel in terms of our methodology, developing, nurturing, and disseminating the models that we develop.
At JDC Israel, we get up every day committed to develop solutions to the social problems faced by Israel's most vulnerable citizens. Years of experience in social innovation have led to our model for developing critical social services. From idea to implementation, this is the DNA of JDC. First, we identify social challenges at the national level. Then we study the field, collect data, and recruit partners from government, local leadership, civil society, and the business community. With the help of the best minds, we develop an innovative, effective response. When the program is ready to be tested, it moves on to the next stage. Now it's time to test the program in the field. In a 3 to 5 year process, we pilot the program, measure its success, and use the data to refine and improve the program so that it provides the most effective response to the challenge. We also make sure the program works in different environments, checking what works and what works even better in order to change reality. And now the final stage, handing the program over to our partners to take it to scale. Throughout this stage, JDC continues its involvement, helping integrate the program into existing social services. Every day, more than 1 million Israelis utilize social services that JDC Israel helped develop. Because social change is in our DNA. JDC, Israel Center for Social Innovation.
Great. I must emphasize that when we say JDC's work here in Israel, really it's for the good of the citizens of the country. And for anyone who knows a little bit about Israel, we have a very, very diverse population. A significant proportion of the population is Jewish. There's about 25% are an Arab population. And even within that, within the Arab population, there are Muslims, there are Christians, there are Druze, there are Bedouin. Within the Jewish population, we have Jews from all sorts of backgrounds around the world. So it's really very multicultural. We have from the former Soviet Union, there were approximately 1 million people living in this country, from Ethiopia, from North Africa, and from various other places within the Middle East. So it's a very diverse culture. And what's important is when we develop these models is that we can then adapt it, that they should be adaptable across these various populations. Okay, so we're talking here, we're going to focus specifically today on older adults in Israel. And let's take a little bit look here at life expectancy in Israel, because this is really the starting point. If we go back some 70 years to 1950, we see that life expectancy was sitting at around 67. And if we look today, it's approximately 83 years old. And if we go according to projections, these were projections taken pre-corona. So life expectancy is looking really, is going to exceed 90 years old based on projections as of perhaps last year. If we take a look at the next slide, which looks at the growth in the population in Israel. So we can see the growth in the general population is forecast at approximately 30%. In Israel today, there are approximately 9 million citizens, and that's expected to increase by 30%. But if we look at the older adult population, 65, when we talk about older adults, we're speaking about age 65 plus. So there, the projected increase over the next approximately 15 years is 85%. But if we look at the ages 80 plus, what we may refer to as the old, everyone's got their own terminology for that age bracket, we can see that the expansion the growth is really 130%. So we understand life expectancy is increasing, people are living longer, and overall the population is aging. If we look at the next slide, so we will understand that currently the older adult population makes up approximately 11% of the population here in Israel. It's approximately 1.1 million older adults out of 9 million, but that's going to increase to approximately 15% of the population. So we understand society is aging. A greater proportion are going to be also in physical numbers. There are going to be more older adults. It's going to be a greater proportion of the population. And it's important that we prepare the country for the aging of its population. And really, that's what JDC Israel, and specifically our organization called Eshel, which is that department focused on the needs of older adults, is doing within Israel. So that we're really assisting the government to prepare the country for the aging of its population. If we break down the population within Israel, so we can see approximately 80% of what we term independent older adults. That is older adults with high levels of functional ability, that's cognitive and physical abilities. Approximately 17% have reduced functional ability. And then 3%, really the number is approximately 2.7%, are those who reside within geriatric institutions. So ultimately, approximately over 97% of older adults in Israel are actually living at home within the community, and only close to 3% are actually living or residing in geriatric institutions, which is an exceptional number. It's a number approximately 2 decades ago, it was sitting at approximately 90 or 92% who are living at home, and that's now increased to close to over 97%. And with the aging of the population, we want to keep that number where it is, if not improve on it. To really minimize the number of older adults because we all know that older adults ultimately, they want to remain at home, they want to live at home and continue to live within the community as long as possible. And really that is what we're tasked to do. If we look, what we've done here in JDC Israel is we've identified 3 key junctures in the aging process. If we look at the first juncture, and yeah, we do have a 4th juncture, end of life, and we'll talk about that, but 3 key junctures. The first is around pre and post-retirement. The second is around decline in functional ability. And the third is around loss of independence. Really, when we talk about the close to 3% of the older adults who are living in geriatric institutions, that is really to the right of that final juncture, loss of independence. But everything to the left across the other 2 junctures, that is where JDC Eshel is active. Specifically pre and post-retirement, we're involved with developing models for independent older adults, around declining functional ability, interventions for those with reduced functional ability, such as rehabilitation, dementia, and various other services within the community. And our mission really is to develop a continuum of services across these key junctures. So if we want to look, Eshel is a government partnership with the longest and widest expertise and reach in developing and implementing services for vulnerable older adults in Israel. Next slide. Okay, we spoke about this a little bit. All right, so we'll jump straight ahead. So what is our strategy? Going to the right, the development of system-wide services. We spoke about the D and A, that we identify the gaps. We then design and develop interventions or models. We then nurture those, ensure that they are sustainable, measure them, evaluate them, and ultimately we hand them over to the government of Israel. We phase out of the operational and financial responsibility, and the government of Israel can then disseminate those throughout the country, across the various cultures, and across the population. So JDC over the last 50 years, so really we're really active in all 240 municipalities throughout Israel. we were actively involved in it. It's important to note that we're not a service organization, we're a development organization. So in terms of implementing the programs on the ground within the field, that is done by for-profits and non-for-profits. So when we established 50 years ago, there were no non-for-profits for older adults. So JDC Israel was actually involved in setting those up. And today there are 120 NGOs for older adults, and we can use, and they're all independent of JDC, and ultimately they can implement a lot of our programs within the community. Some of the things we've established are over 180 daycare centers throughout the country, and 300 supportive communities, which we're going to chat about a little bit later, throughout the country, 150 centers for preventing abuse and neglect of older adults, and various other models that we've developed and accelerated throughout the country over the last 5 decades. Next. Great. So, I mean, ultimately, if we go back 50 years, the approach was a person ages, they reach around the age of 65, and then they move into a geriatric institution or into an old age home. And with the aging of the population, the growth in older adults, there was an understanding we need to develop an infrastructure that would enable older adults to be able to age, to continue aging at home, to age in place. And what this required was community-based services, something that would enable older adults who are aging at home to improve the quality of their life, respond to the needs that were not already being met within the community, at the same time to contribute to a feeling of security within their homes, as well as to impact their ability and willingness to continue to live at home within the community. And this was the mindset that JDC Eshel undertook when it started looking at various interventions and models that were required to be developed. And one of the key models that we have developed and we've been successful in within the past couple of decades has been the supportive community. At this point, I'd like to hand over to my colleague, Yehudit, who is the manager responsible for the supportive community program model here with JDC Eshel, and she will speak to you a little bit more about that. Thank you.
Thank you, Mark. I would like to excuse my English. It's not the best English like Mark. Okay, so what I want to tell you first is how it all began. I want to tell you about Amir, that he, in the year of 1981, he and also with a group of people together, they lived closely and have a social life in Jerusalem in a neighborhood named Kiryat Moshe. And on his 62nd birthday, he began to think about what happened when he saw the retirement. And they began to think about what happened next in a few years. So Amir and some of his friends from Kiryat Moshe have decided that they will create for them a supportive environment that it could give them everything that they need, that they want. They needed an operating body, some of that that could arrange the operate services that they need. Amir and his friends came to us, to the JDC, and we planned together the intervention model that we called it later the supportive community. After we built the first supportive community, we understood that it's a program who can answer the needs of elderly in Israel from all kinds of culture. And like Mark says before, we built 300 supportive communities in Israel. And the next stage that came was to create a program that could answer also people without pensions. So we did a collaboration with the government, and they are subsidizing today elderly that don't have the money to pay for this. The next one. The goal of supportive community is to provide critical services to enable older adults to age in place. And we're talking about 3 guiding principles. The first one was to make the elderly, like we did in Kiryat Moshe, we want them to be a part of the process. We want them to help us to decide what kind of needs do they have, and from that to get to the services. We wanted them to have options. And the third thing that we wanted it to be flexible and dynamics, that all kind of elderly can find themselves in this program, and also that they can change their mind. It's okay that from one point you need this, and after 3 months, 1 year, you want to change your mind and find a different services that you want. The next one, we have 3 key factors for the supportive community. The first one is that the supportive community has a range of services to the elderly. I said that before. We want all kinds of people to find themselves in this community. The program can answer all kinds of population and needs. The second one is our innovation is a sustainable business model. It means that the model business that we created is when we get to 200 elderly in the community, you can be sustainable. Mark said before that we come to organizations that they are doing the program, and we want them to have the ability to do the program on themselves. Also, we have a technological management tool that can monitor measurement and effectiveness. What the process that we are doing, we begin with the main needs. We ask the people what do they need in the community. We are looking for the existing services that already have in the community, and this minus that we have basket of services, and we want to try with you now to see what are the main needs that you think that you need. So we will have now a short answer that you need to fill. What are the main needs that which you think, okay, for you or for your parents, that people need to age at home? You can choose 2 to 4 options of needs that you think that you need. Take like 1-2 minutes to think about.
Just to say, if you wish to suggest another thing that is not on the poll list, then write it in the chat box. Does anyone need a few more seconds to think, or are you good? Okay. Okay, so okay. Great, thanks, Dee. The poll doesn't allow only one option. You can choose up to 4, please. So if you wish to keep on adding answers, then go ahead. All right. So I'm going to end the poll and publish the results and mute myself to give the platform to Naomi.
Thank you, and Naomi will continue from here.
Hi, everyone. As we see, we have 22% who thought about medical services and health, 11% is personal security, 11% transportation and accessibility, and home repair and home cleaning. Sometimes we will have a variety of needs, and we see that those are mostly the main needs also in Israel for the elderly, and this is like a universal needs. But what is important to know is that the needs are sometimes will be very personal and very local needs, and the program of a community, a supportive community, gives answers also for the local and also for personal needs, with a flexible basket of services. What we found what we identified in Israel, that there are 4 main reasons that if we can manage them, we can increase the chances of a person to stay at home at their community. Safety and security, as came up on the poll, health condition, lack of social connections, and home maintenance. Can you pass? Thank you. The services offered in Israel's supportive community are health, social activities and social connections, economic and personal safety. We are aware that the elderly can get those services on their own, but placing them under the program umbrella, they get the accessibility to the services all in one place, and also they will get it much cheaper than they would get it by themselves. Otherwise, they might not get the services and they might not know about those services. Each community will have a different basket of services. The baskets of services are built according to the needs and the preferences of the community members and their culture. As you see, we do those 3 services: the personal safety, health, and social activities. That under each one of those names of the ABC, there are lots of small and different services that are coming under the name tag of personal safety, health, and social activity. And what we recommend is that up to 200 households per supportive community. This way, the members get a personal services, and it's a sustainable business model. Okay, what we would like to do now, we will break you down to, I think, like 3 or 4 rooms. And we would like you to focus on one need that came up in the survey, and think of a service that is efficient and flexible that will meet those needs that you will discuss in the group. You will have 15 minutes for the discussion in the room. When we will return to the plenum, we will ask a representative of each group to present a few words about the service you choose in the group, or you offered in the group. So we're going to divide you now to, I think, like 3 rooms or 4 rooms, Noam?
I'm unmuting myself for a second because Kim, I don't seem to have the breakout session option maybe because I'm co-hosting. But do you have it to help us break out?
And each one will choose the need that they want to discuss about, or we will give them the need.
We will assign.
We'll assign them the needs. Okay.
I think we should. Kim, you're on mute if you want to speak.
So until we are divided to rooms, what is important to me to say is that the basket is very flexible. The basket of services for every community is very flexible. The member of the community can choose and can change the basket every it depends on the community, on the supportive community, but they usually every 3 months they can change the basket of services from a big basket. So they can choose every time different because the needs of the elderly also changes during the time. So sometimes they need a different service, so they can choose it they can choose and they can change the basket. Okay.
I'm assigning you all now. You'll briefly see the 3 group themes. I'm sorry. Right. Okay. Go.
Okay.
Whoever is with me on this hall, Pauline and Cody Institute, you are still able to join the groups we've assigned you to.
Hello. I don't hear you. Okay.
Salut.
Salut, ouais. En fait, I want to go in the room of independent.
Oh, yes, but the sessions are now ending, so everyone is coming back and sharing their thoughts. So everyone is going back out of the rooms in 9 seconds.
Okay. So I need to wait.
Yes, wait here, and then everyone will be back together. And
yeah, great. Yeah.
Okay.
Back.
Hi, everyone. Sorry if you were cut off abruptly. So I'll put us back to the presentation, and I assume you have decided who will be sharing the group thoughts.
Mm-hmm. No, before we don't share yet the presentation, I think we can do the discussion here in
Go ahead.
In the main group. And did everyone came back?
Yes, everyone's back.
Everyone is back. Okay, great. Who is the first? Is a group number one who wants to be the first one to share with us the discussion and the service that they choose for the need, to answer the need?
Not all at once.
We'll do it the Israel. We'll just do it the Israeli way. We'll just tell you.
Okay, Paulina, are you ready to?
Yes.
Okay, great.
Yes, thank you. So I had the pleasure of speaking with my fellow unconference goers about independence related to seniors. And we came up with 4 services that we thought would help seniors maintain their independence as they age in place or age at home. And the 4 services that we talked about were number 1, having a handy person, someone who could help out with home maintenance, property maintenance, things of that nature. Secondly, we talked about perhaps having assistance with doing personal shopping, whether it be groceries, pharmacy, personal items of any nature. That would also be helpful. The third point that we talked about was helping seniors utilize technology to enrich their lives, to increase the quality of their lives, whether that be keeping in touch with family, other community services, staying abreast of the news, anything of that nature, but things that they could access via technology that they would be without otherwise. And finally, we talked about something that I use the word, and hopefully it captures the group's intent, was more of an accompaniment role. So as seniors continue to live in their homes and maintain their autonomy and make very independent decisions and choices, they sometimes have a hard time or a harder time implementing those choices and decisions. So if there was a person of trust who could accompany them when they're making decisions for themselves, that would allay any anxiety or fear that might come along with the process, that would be an extremely helpful service or role for someone to play. And we envisioned these pieces of assistance perhaps being offered by different people. We didn't know that it would necessarily be the same person or service for all 4, but there might be a need for custom services to help seniors maintain that independence. And if anyone else wants to offer anything from the conversation, in case I missed anything.
No, I think you did a great job. Thank you for sharing.
Thank you. Oh, thank you.
Who is next to share with us?
Kim, you want to shoot?
Sure. Hi. So I was telling our group that in my town, we have a group called, they're little nonprofits, but they're called villages. And in our town, it's called North Shore Village. And it's a local organization. It's really an association. People do pay a small fee, but so the elder population can join this group, and they are able to, their social activities, they can arrange, someone will come up with a book group, someone else will come up with maybe inviting someone who comes to speak. And so it definitely helps reduce social isolation. And they also have those who can volunteer to drive people to doctor's appointments or shopping, and then they connect with others in the community. For instance, students. We were talking about, one of the folks in our group was saying they have a organization or something in France where people or older people are on social media. And so in this group, they'll have the younger members who understand social media connect with the older members and exchange knowledge. And then oftentimes if the older members have skills, they do a sort of an asset inventory, and they have skills and gifts that that the younger people want to know. They'll also do that sort of exchange. So it's a kind of win-win for everybody.
Did we have another group, I think, right?
Yes, D.
Gord was going to be the spokesperson, but he had to go to a meeting, so it's me.
Okay.
I think we just broke the rules and talked about whatever we wanted, and Noam kept coming in twice and said, you know what you're meant to be talking about. We're like, yeah, we're getting to that, and I don't think we got to it. But in listening to the other two groups just come back then, it ties into what we did talk about. And so I think that what it's making me realize and think of is that even though we might put things in different categories or essential services, it's really about a holistic approach, you know, and it has to be kind of all of that. But one thing that we did talk about a lot was, because it was about maintenance, but it was about, Gord talked about his father that was managed to stay in his home for a year longer because neighbors came in and helped and that kind of thing. So that was really good. And I was saying that my mum's just moved off a property into her own place, and I'm on that end of thinking about it, of how do I help mum? How do I not be pushy? What supports are there, that kind of thing. And I would look to her neighborhood first, and because she is a social butterfly, and she's lived there now for like 2 months, and she knows everyone, you know, so we're walking down the street waving at everyone and knows all the dogs' names and all of that. So I know that she'd be in a good environment. So I was thinking about what would that look like if kind of not, I don't want to use the word formalized, but I don't know, kind of like as an informal aged care neighborhood support something like, yeah, I don't know. I use the word hub, but that's not right either. So yeah, I think we didn't do the task at all, but thank you.
Okay, did we have another group, or we had only 3 groups?
These are the 3 groups.
That's it? Okay.
I'll just share what Kut and Ibrahima shared with us. Really interesting. I mean, Kut painted a very bleak picture of Cambodia. So I know I'm breaking the rules, but it was, but I'm just going to share what they said anyway. So Kut painted a very bleak picture of what's going on in Cambodia. I'm just reading some of my notes that I took. He said really that, you know, there are lots of problems there when it comes to the elderly. Many are poor. Many are migrants. There's issues with nutrition, with food items, and they're desperate to find some kind of healthcare intervention, an intervention to enable them to act for active aging, both physically and their cognitive health, and something that just to keep them active and motivated and sustainable. And he said they really need a social security support program, and their organization can then go and advocate to the government for support. And I understood, Kut, unless you want to jump in, that, you know, there isn't really much in terms of interventions to enable them to continue aging healthily as it stands. Ibrahima, and feel free, Kut and Ibrahima, if you want to jump in and add something. But Ibrahima is from France. And so he spoke about a social media application that they use where the older adults each have their own profile, And on their profile, they could write all sorts of things and interact with others. And there's a lot around accommodation and sharing accommodation. And there's a big issue with accommodation there in France, so that they can pair up with others. Of course, it assists them with dealing with issues of isolation. And he says many of the older adults don't work, and they're trying to look to how to improve their overall life condition. They're sitting around all day, not doing much, and so they have the social media application, which seems to be doing wonderful things. And then we spoke about intergenerational initiatives, and he said there's actually it's quite popular there that the young co-host with the older adults, so they even may live together and help them in their day-to-day tasks, which I think is a fantastic thing. I'm sure we all agree that intergenerational, mixing the young with the old, it's really a win-win situation. And this is something that already exists there in terms of them living together and working and helping one another. So that was something that was really interesting.
Yeah, so we saw different kinds of services that was offered by the group discussions, and I would like to give you some examples of services that we give in Israel in the supported communities. But beforehand, I want to say that we have 3 staff members in each community. In each community, one of them is a father, mother. It depends if it's a female or male person that is like a father or mother of the community, that they come in and do small repairs. They visit each one of the members once a month or once in 2 months, not on call, but then they are on call 24/7 for every small thing. If they have to have a small repairs and stuff like this, they come in and do it for free. If it has to do any changes of supplies, so the members are paying for the supplies only. And this to answer about Nick and a suggestion about handyman. So the father-mother community are the handyman. They are also sometimes will bring the medication to the person from the pharmacy, or they will bring in the shopping. Some of the we have the manager of the community that she runs the community, and we have I would call it a person who are responsible for the leisure time and as a social activity in each community. I will give you some examples of services that are adapted to a culture or to a specific needs that we do in Israel, like the Ethiopian immigrants, the Jewish Ethiopians immigrants, that they didn't, that they got a culture mediator to help them deal with the bureaucracy and different stuff in the membership. They wanted also to have we had with them a community garden where they can grow up, they can grow vegetables and continue being agriculture as they used to be in Ethiopia. Some of the people wanted a medical service or a medical service, so they got an emergency button, so they can press the button every time they feel unsecured and get a personal answer, and they can call they have a doctor on call, and sometimes they can call an ambulance, and they will have to pay very small amount of money for these calls. Like, I think it's something around $5 each call like this. If the doctor, the ambulance comes in and it doesn't get hospitalized, so they pay the minimum amount of money. And this is kind of, and now the Muslims have like the Ramadan fast month. So for them, we will have a special, during the Ramadan, we will have a special social activities, including meals in the end of the fasting day for them. And this this is a kind of the different services. Now, in each community, we'll have a different basket. It depends what the people are choosing to do, or what they are writing that their needs, or what they prefer. like we have one small city that they have transportation. They have like one minute, I need the word ran away. They will have a voucher for a taxi drive transportation, like once a week or once a month, and they can use it for anything that they choose to do. So and now I'm happy to pass on to Mark to continue the presentation. Mark?
Right before I'll have Mark share, I just want to open for questions. If anyone wants to unmute themselves, maybe to ask some questions. Ibrahima, you wrote something you might want to talk about?
Yes, I read that if anyone do services for make orders independent, if they can present their activities and we can to interact if it's possible, please.
I'm not sure I understand your specific question. What do you?
So I say that I want that if they have people that in this room.
Okay, non-JDC people. Okay.
Yeah. That make services to others and to make them independent. If they can present their activities.
So this is an open question for people who are non-JDC. So go ahead.
Exactly. For all.
I could talk about what we're doing now during the COVID time, which is a town. I live in a town called Pennycook, has about 25,000 people in it. And we have 300 volunteers who are collecting pharmacy, food, and things like that, and delivering it to people's houses. And also from our church here, we run a library service of toys, games, DVDs, books, which people request them, and they're delivered once a week, and they're collected in from people once a week, and they're then kept for a whole week in a separate storeroom until they're not in danger of infecting the stock and put back into stock. So though it's not a service for the elderly, it is mainly being used by people who are elderly. We also run a phoning contact group. I've got about 60 elderly people in my congregation, and I've got 10 people who every week phone at least 6 people and contact them on a weekly basis and know that they can be contacted. They will deal with just general social interaction, but also deal with specific requests for things. And what I've started doing here is to have conversations with the various people in the town to try and see how do we continue this after lockdown. And I think that's going to be a big issue for us, is to say we don't want to lose all of this good work, all of the people that volunteered. How do we build on this without it becoming so formal, so bureaucratic, with lots of paperwork and lots of security clearances, that it is just good neighbours doing things for each other. And so it comes back to some of the real basic ABCD principles, I guess. How do we go about delivering this? And that will have a disproportionately larger benefit on the older members in our town. And this isn't being run by the church. This has been run by volunteers. The church is just a place that has plenty of space at the minute that we can't use, that they can use to do work from. So I think that's really important. It's seen as being owned by the town, for the town, by the town, not by someone doing it to them. The trick for us is to convert this into something that will sustain in the long term, that doesn't get clogged up with bureaucracy. And we're in what's called a unitary authority. So the whole of our region, which is called Midlothian, just south of Edinburgh, that's the only council there is. There isn't one for each town. There are supposedly democratic groups called a community council that represents the town, but it has very, very few resources and no authority. So it's a sounding board. So I don't, if Ibrahim, that doesn't probably answer your question, but that's our context today, and what I'm trying to encourage the town to do as we move out of lockdown is to keep the best of what we've got and get the town to flourish in a new way.
Thank you. Mark?
Does anyone else want to share?
Sorry.
Thank you, Nick. It's okay. Thank you, Nick. It was very interesting. Anyone else? Okay. So go ahead, Mark. I'm going to share the screen for us to go and touch a little bit more about the key success indicators of the program, maybe something that will help Nick in the question of how to formalize it, or how to model what you've done, which is good neighboring, but how to put it in a working method. So go ahead, Mark. Everyone sees the screen?
Great.
Great.
All right, so I mean, we look over the last 2+ decades since the support of communities was first piloted in that single neighborhood in central Jerusalem. And today, nearly over two decades later, we're looking at 300 communities, well over 60,000 older adults who have chosen to connect with one of these communities. And this number will no doubt grow. And JDC, again, we're not a direct service agency. We developed the model and we have professional oversight, even though this is something we've technically handed over to the government to oversee. We have the professional oversight, and we were involved in training these operating agencies. We continue to train through our the 3 training centers that we run in this country, continue to train the community fathers and mothers and other professionals who work within these supportive communities. So we're very actively involved in that. We've run 2 key evaluations, one of them about 20 years ago, another 10 years ago. The one 10 years ago was focused on, I think, 246 to 48 supportive communities. And some of the key findings, 96% of the respondents from these hundreds of supportive communities said that they're satisfied with the services that were provided. 90% said that they received the assistance they required. Some 66% said that the community contributed to their personal safety. So overall, it seemed to be the model was viewed as being successful in that respect, and that the older adults were receiving what they expected from the community, and was enabling to age with security within the community. And if we look at this last bullet here, the strategic asset in national emergencies, and I think this hasn't been more evident as it has in the last 4 months in the time of COVID. And of course, this is not the only national emergency that we may deal with. But what is essential here is, in times of crisis, you cannot quickly invent a major infrastructure or a response. It's very difficult to suddenly build something from scratch. Especially when there are constrictions in place, as we've faced in the last couple of months. So when building an infrastructure, when building a model, putting something in place, it's important to build something that is sustainable, that's resilient, and that is a robust model. And you really only know that is true in times of emergency, because in times of emergency, you should be able to take that infrastructure and to develop it, to adapt it to the changing times, as we've seen now for example, over the time of Corona. Now, what is the benefit of an existing sustainable infrastructure? First of all, the existing relationships, specifically with the NGOs or the for-profits that are operating, in this case, the supportive communities, their existing relationships with the government, with JDC, and all the operating agencies. Those are in place. There are existing relationships with the professionals and the volunteers. And we're talking about older adults. It's, let alone a younger person. Are you just going to open your door and let somebody into your home, even though they're coming with good intentions of helping you? Older adults are much more wary of who they're just going to open, who they're going to let into their home. So these relationships are already in place. We're talking times now of crisis where people have additional needs and there's a level of desperateness. And these relationships are already in place now, where there are people who they can already talk to, who are in touch with them and can support them during these times of crises. So in terms of an existing infrastructure, the relationships are vital, and key is the trust that already exists between the professionals and the clients within the communities, with the clients as well as the services they're receiving with the infrastructure and the NGO. There's no unknown factor here. We're taking existing infrastructure, which is then able to be adapted to the times. And the clients are already comfortable. They know what is, in this case, a supportive community is. They know who the people are that they normally deal with, what they receive. And of course, when adaptations are made, they'll be more comfortable in dealing with the change, as well as reaching out to these individuals and being honest about their changing needs or some of the new crises that they may be going through. And really leads to, you know, if we look, okay, which one are you going to stop on? Okay, so in terms of building a supportive community, this is still something that, you know, we may have 300 around Israel today, but it's still something that they're growing. There's still a need. We're talking about, you know, 1 million older adults here. And, you know, the question we ask is, how do we establish a new supportive community? We've got a model that works. It's been evaluated. It's shown to, it's sustainable. But again, we've got diverse community, diverse cultures, not only within Israel, throughout the world. So how do we now go and implement the supportive community? So we've got here, if you look on the right, this flow chart. First of all, we would start, choose a community. What is characteristic of that community? Is it a diverse cultures? Is it one specific culture? It could be, we're talking about ultra-Orthodox Jews. It could be, we're talking about Ethiopians. It could be talking about an Arab and Jewish mixed community. These all exist in this country. Then assess the needs and the preferences. Get to know who are the individuals, who are the older adults, what characterizes them, and what do they want, what do they need. Similar to the, you know, what Naomi was saying with the Ethiopian community in Afula. The Ethiopian community was a community that what their needs weren't being met in general within the supportive communities. And so we had a rethink and we thought, what do we need to do to bring them in? And we made some changes and voila. And, you know, it had a wonderful impact. And we saw more and more of the Ethiopian older adults understand, feel comfortable in getting involved with the supportive communities. So again, the outreach to the older adult, make them partners in this, tell them what this is all about, what are their needs, what do they want. And once we've got an understanding, a full mapping, and understanding and earn the trust of the older adults, then we can identify local service providers. It may be an NGO, it may be a for-profit, it may be the local, one of the departments in the local municipality. Find what is
Mark,
suitable.
just 1 second. Dee has a question, so let's pause for that question. Dee, go ahead.
Thank you. Thanks, Mark. Just wondering, where in that cycle do your strengths and assets come in? Like, I know they'd be intrinsically in there, but when you're looking at kind of those assessing needs and preferences, maybe it's in the preferences. Just wondering, like, when's the identification of, you know, now we know what the needs are, what are the strengths that's going to address that?
Well, in the same, I think it's in the same phase of the assessment is not only for the needs. The needs is what we take out of the equation after we reduce how the other needs are met, and we try and fill the rest of it in a cooperative way. What that means that if you look at the choosing of the local service providers, then you need to come to think about it as a cooperative that has a win-win situation. In fact, if I'm a local service provider of some sort, let's say I'm a plumber, okay, and I wish to give services to people and to be chosen or to be thought of as trustworthy and give a good price and to be someone that will be called by people living in a supportive community, then I'll need to adjust my price and I'll need to be vetted by the supportive community, and then I know I'll have access to all sorts of clients that are potential clients for me, and I will feel comfortable using my service. So that's the point in which everything is gathered around the trust, while people are being trusted to provide the services, and people that are most vulnerable or wary trust the community to increase their access to people who are trustworthy. So these are all local services.
Yeah.
Does that answer your question?
Absolutely. That's what I said. I was sure it was intrinsically in there. Yeah, that's fine. Thank you.
Okay, so just to continue, we said choose a local service provider. We've got a sustainable business model that we know is proven and works, and whether the service provider is an NGO or a for-profit, the same business model is in place. We know here in Israel there is a set pricing structure. It doesn't matter who you are. The older adults who can afford it, they will pay a maximum of around $37 a month. If they can't afford it, they'll be subsidized by the Ministry of Welfare. But that model is consistent throughout the country. Once we're ready to establish the supportive community, we'll put a CRM system in place, implement the program, then assess the usage once things have been implemented and are up and running. And really, this is a cycle of re-engineering and relearning here. So whereas we've got a model, we've got a sustainable model, and yes, whereas it may be running over 300 different communities, we understand every community is unique, and part of the success of this model is adapting it to the people, adapting it to the changing needs. Even if we go back 25 years from the first supportive community, and we look at the demographics of the older adult community then, and we fast forward another nearly 3 decades to the demographics of the older adult community now, people living longer, old living at home. So we need to consistently adapt the supportive communities to meet the needs of this changing population. That takes us right back to reassessing what we've done. So if we go back, it's covered up. All right, next slide. So as I said, JDC in general, we've been involved with, we ran 3 training centers, one in the north, one in the south, and one in the center of Israel. We ran over 80 different courses, not just to do with supportive communities, but really on topics covering all areas to do with older adult services. But yes, there are courses specifically for the supportive community professionals, the paraprofessionals, and volunteers. And every year, approximately 3,000 professionals go through these training centers. I can say now, just over the Corona period, over the last 3-4 months, where we were providing a lot more training for social workers, occupational therapists, and volunteers who are working right now with older adults under different environments. And we trained over 1,460 different professionals just over the last 4 months, specifically to prepare them on how to work with older adults under this new environment. So the training, and of course this was done online, not face-to-face. So there is we used to talk about blended learning. Now that blended learning has very much gone online learning. So we're very active in terms of training, and we're the go-to in terms of training of professionals, paraprofessionals, and volunteers in that respect.
And now typing in the chat box for everyone, it's a resource page that in English that we provided during COVID times with different videos and knowledge that all kinds of professionals can use to support elders in their community.
Okay, and I just refer back to the 3 junctions I spoke about earlier, where we were looking at independent older adults, those with reduced functional ability. I mean, today, five decades of service development by JDC Eshel, we're reaching, we estimate probably 33% directly of the older adults in Israel. And really that's because 80% of older adults in Israel are already independent, high functional ability. And only in the last half decade, the last 5-6 years, are we really investing in that population specifically. but in terms of we're covering the full juncture, we're developing our scope of services, and it's important. Why the focus on training? Because we can develop all the models and all the services in the world, but it's important that the professionals, the paraprofessionals and volunteers who are serving the clients within these models, that they have constant training and courses that they keep up to, because ultimately we want to ensure that there's service excellence. That we can put the best models in place, but if we don't have service excellence, we're doing the older adults a disservice. And I think that really brings us to the end. This is a gentleman. He was unfortunately he's since passed away, but he was 102 years old when this photo was taken. I think it was 6 years ago by one of our colleagues in JDC Eshel. There was the president of the country invited Centurions to his home, and they had a big celebration for them. And this gentleman was very proud. I think he was from the former Soviet Union, well-decorated soldier, and he was 102 years old, and is perhaps one of the poster childs of what we'd like to think that we're doing here in Israel.
So I'll stop sharing for a second to take a group photo and leave time for questions as well before we sum up this session. Does anyone want to raise their hand?
That's good to Ibrahim. Great. So
I'm taking the group photo, so everyone who wants to be included, take your camera on or off, your choice. Hi, Eric, nice to see you. Great. Taken. So if anyone wants to ask some questions before we wrap things up. Right, so I put the resource link in the chat box. You can all feel comfortable visiting and writing us. And I'll thank everyone for joining us today. Hope this was insightful. And thank you, ABCD, for giving us the opportunity to join or to host a session in this unconference. It was a very unique experience, I think, speaking in the name of my JDC colleagues. And thank you everyone for joining us from all around the world and all types of hours and dispositions. Yeah.
Thank you so much.
Thank you.
Thank you, everybody. Thank you, Dee.
Thank you, Dee, for what you wrote.
Yeah, very good.
Bye-bye. Thank you
Bye.
very much.
everyone participating.
Yeah.
Bye. Thank you.
Bye, guys.
Thank you for
See you another
joining
day.
us.
Yeah.